Welcome you all for this third session of Shalyatantra online guest lecture series 2023. It's my immense pleasure to welcome you all for this online guest lecture series on critical analysis of Raktamokshana by well-known person, Dr. Rakesh S. Gujar sir, Assistant Professor, Department of Shalyatantra and BLD is Ayurveda Mahavidyalaya, Vijapur. I would like to call Dr. Anisha ma'am for a welcome speech for this event. Over to you, ma'am.
A very good morning to all. Welcome to the online guest lecture series Shalyatantra. Myself, Dr. Anisha S. Ashraf, Assistant Professor, Department of Shalyatantra. It's indeed my pleasure to welcome today's guest speaker, Dr. Rajesh Kumar S. Gujar, Assistant Professor, Department of Shalyatantra, BLDAS AVS Ayurveda Mahavidyalaya, Vijayapura. I welcome you, sir, to this event. Now it's time to welcome the backbone of this institute as well as our Shalya department. It's none other than Dr. B.S. Savadi sir, Principal and HOD, Department of Shalyatantra. Next, I wholeheartedly welcome Dr. Geetanjali ma'am, Associate Professor, Department of Shalyatantra, to this event. Now it's glad to welcome my colleagues, Dr. Lohit sir, Dr. Jitendra sir, Dr. Sangappa sir, to this event. I welcome you all. Last but not the least, I welcome all the PG scholars, UG students, and all the participants to this event and making it a grand success. Hope you all will get a wonderful session from this event, especially from our guest speaker, Dr. Rakesh sir. Once again, I welcome all. Thank you.
Thank you, ma'am. It's my immense pleasure to welcome Dr. Rakesh Kumar sir, and it's an immense pleasure to explain about Dr. Rakesh Kumar sir. Sir has completed BMS from BLDA's AVS Ayurveda Mahavidyalaya, Aided Medical College and PG Center, Bijapur in 2013, and sir has completed MS in General Surgery from Government Ayurveda Medical College, Bengaluru, and MS in Clinical Nutrition and Dietetics, KSOU, Mysore in 2021. PhD scholar at SJGCHS, Ayurveda Medical College, Ghataprabha, and MS Sanskrit scholar at KSU, Mysore, and academic excellence of Dr. Rakesh Kumar sir is published 11 research articles in indexed journals and ongoing research on Arsha as a part of PhD studies at RGHS, and ongoing research on Budabramsha at BLDA's Sri B.M. Patil Medical College and Hospital Research Center, Vijayapur. Presented the scientific papers in many international and national state level seminar, workshop and webinars, and given many guest lectures on awareness of Ayurveda with special emphasis and Ayurvedic surgeries. Worked as the organizing member in many national and state level seminars and workshops, and work experience of Dr. Rakesh Kumar sir is he has completed 6 months internship at BLDs and BM Patil Medical College and Hospital, Jaipur. Worked as a resident assistant surgeon at KC General Hospital, Malleshwaram, Bengaluru, and currently working as assistant professor, Department of PG Studies in Shalyatantra at BLDs AVS Ayurveda Mahavidyalaya, Jaipur, and co-founder and visiting consultant Ayurvedic physician and surgeon at GIAF's Ayurveda Asia Hospital, Bengaluru, and he has sir is well experienced in conducting major and minor OT procedures, Ayurvedic surgical and parasurgical management in anorectal disorders, and critical emergency conditions like ET intubation, ECG regarding, and radiographic and managing emergency conditions. And he is well known, and he is given many lectures on anorectal disorders. Thank you, sir, for and we are we'll welcome you to this session. Over to you, sir.
Thank you for your nice introduction, Dr. Jagdish or Dr. Sangappa Kamble.
Sir, voice is not audible.
Theoretical aspects of Raktamokshana. What are all the theoretical aspects of Raktamokshana we will come to know, right? And then the second point is, the target of my lecture will be this is to know about the theoretical aspects. Along with the theoretical aspects, you will also be knowing about the concepts to be very clear. The concepts related with the Raktamokshana will be very clear. And also, independently or individually, you can practice the Raktamokshana very fearlessly. It might be might be the UG student or it might be the PG scholars. Independently and very fearless, you can practice this thing. Right? So the first shloka which I want to say to you is that the importance of Raktamokshana. This is the most common thing, and for the examinations also it will be very important and the most common question which will be asked in the Vivas also. So the shloka is Sira Vedas
Screen is
Chikitsardham.
not visible, sir. Can you please share your screen, sir?
Okay. So here it is. The Sira Vedas Chikitsardham Shalyatantra Pakirtitah Yatha Pranita Samyak Basti Chakaya Chikitsita. This is the reference from Sushruta Samhita Sharirasthana 8th Adhyaya. So Sira Vedas Chikitsardham means in among all the chikitsas which are related with the Shalyatantra. Shalyatantra means it might be the Vrana conditions or wherever there is a related with the Vrana, or it might be anything which is related with the Shalya Avadharana or Vrana Vilchaya. So any of the Shalyatantra related diseases, Sira Veda is considered as a Chikitsardha. Chikitsardha means half of the treatment will be done only by the single concept of this Raktamokshana. If you do the Siravedana, is one of the type of the Raktamokshana. If you do the Siravedana, it will be half complete. Means you will be completing or you will be giving the half chikitsa. Complete means 100% chikitsa. If you are going, the 50% of the chikitsa will be done by the Siravedana itself. Right? Yatha pranita samyak basti kaya chikitsa. In the kaya chikitsa, as it is given the importance of about the basti, the same thing the Siravedana has been given here. So in the next slide, you can see this one. Here, the importance of again the Raktamokshana. Tvakdoshaha grantaya shofa rogaha shonitajashti. Raktamokshana shilanam na bhavanti kadachana. So Tvakdoshanam grantaya shoka. You will not ever suffer with any of the skin diseases. You will not ever suffer with any of the granthis, means any of the cystic lesions or swellings, any of the shofa, any of the inflammatory conditions, any of the shonitaja vadis, any of the rakta-related dushita vadis, and also where it is when you are undergoing the Raktamokshana. Raktamokshana means the Shila, Raktamokshana Shilana means practically or regularly undergoing the Raktamokshana. It might be yearly twice or yearly once. So whenever there is a prakopa of a Pittakala, so generally we prefer to do the Raktamokshana or any of the Siravadana procedures or any of the Raktamokshana procedures in and around the Sharantantu because there will be elevated Pitta. So if you are regularly practicing or undergoing the Siravedana or undergoing the Raktamokshana therapy, you will never ever encounter with these diseases in your life. So this is the importance which has been given. And also Snehadibriha Kriya Yoga na tatha lepanerapi. Yanti Yashu Vyadhayaha Shantim Yatha Samyak Siravedat. So this is also from the same reference, Sushruta Samhita Sharirasthana. So wherein you can see Snehadibriha Kriya Yoga means whenever you are doing any of the Snehadi Kriyas means the including the Panchakarmas, means Vamana Virechana, Snehana, Svedana, Vamana Virechana and all. So Tatha Lepanerapi means the thing which is not at all after giving the, if the disease is there, that disease is not at all cured. After giving the Snehadi Kriyas means Vamana is also done, Virechana is also done, Basti is also done, Lepan is also done. But still, after this also, if you are not at all getting the good result, means if the suppression of the disease is not at all done, then what will be the ultimate choice is, it is the Samyak Siravedat. So if you are doing the Siravedana, means it can be used as the option which is a very potent one. After giving all these therapies, All these things also, if you are not at all getting the things, then you can try for the Siravedana. This is also one of the reference which shows the importance of Siravedana. And also Shunita, this Sita Ushna Snigdha Ruksha.
Sorry to interrupt you, sir. Can you please put your slide in presentation mode, sir?
ಇಲ್ಲ ಇದೇ ಡ್ರೆಸ್ ಹಾಕೊಂಡ್ರಿ
It's in the presentation mode itself, I think.
No, sir. All the sites are not visible, sir.
I think now it's visible, no?
Yes, sir. Yes, sir.
Okay. So the important Raktamokshana. Shita Ushna Snigdha Ruksha. Snita Ushna Snigdha Ruksha there. Upakramantascha Egadaha. So after means Shita Kriya, Ushna Kriya, Snigdha Kriya, and all these things. So if you are doing all these things, means Shita, Ushna, Snigdha, and all, so then also if you are having any of the things, Samyak Sadhyana Siddhanti, Rakta Jamsta Bhavitta. So there also there is a Charaka reference in the this Charaka Samhita Sutra 24 to that Samyak Sadhyana Siddhanti Raktajam Bhavayet. And also Dushta Rakta Apagamanasya. So raga means whenever there is the things which are not at all cured by any of the things which are by the panchakarma means, then you can go for the Raktamokshana. Right? Then Panchabhutikatva also. This is a concept which I want to make it clear, right? So before different aspects or without directly going on to the how where it is indicated and all, we'll just see the basics of the Rakta first and then we'll go to the different things. So Visrata Dravata Raga Bandanam Laghuta Tata Bhumyadina Gunahi Ete Drishyante Chatra Shonite. So Visrata, Dravata, Raga, Spandana, Laghuta. So these are the Panchabhutika qualities, means attributed to the Panchamahabhutas. So all these qualities will be, the Rakta is also having all the qualities, right? So Visrata, Dravata, Raga, Spandana, Laghuta. Visrata is related with the this Prithvi, Dravata is related with the Jala Mahabhuta, Raga is related with the Agni Mahabhuta, Spandana is related with the this Vayu Mahabhuta, and Laghuta is related with the Akasha Mahabhuta. Means Panchabhautika concept of Rakta. Why we are explaining the Panchabhautika concept of Rakta means while we are treating the disease, we can give more concentrate on the Panchabhutas which are related with any of the causative factors of the disease, and then we can treat it accordingly. That the qualities of Shuddha Rakta. So Indragopa Pratikasham Asamhatam Avivarnam cha Prakritistham Janiyat. So the qualities which is like the Indropa Pratikasham. These are the important shlokas. You can note it down or you can have to buy these things. So while hearing this. Qualities of the Dushita Rakta. What are the qualities of Dushita Rakta? Means it is Tatra Fenam Anilam Arunam Krishnam Varusham Tanu Shigram Askandicha Vatina Dushtam. So these are the things which are related with the Vata Dushita Rakta. Neelam Pitam Haritam Shavam Visram Anishtam Pipilikam Akshinam Pipilikakshinam Askandicha Pittena. Then Gauri Kodaka. So Gairi Kedaka Pratikasham Snigdham Sheetalam Bahalam Pichilam Chirasravi Mamsapeshi Prabhamcha Shleshmadushtam Sarva Lakshana Samyuktam Kanjikabam Visheshato Durgandicha Sanipatadushtam Vidosha Lingam Samsrishtam. So when you see the qualities of this Dushita Rakta, whether we are just directly clinically we can classify these things, whether we can say these things directly when we see this Rakta or the Dushita Rakta or all. So it is Ferilam Arunam Bhuksham Parusham Tanu Shighram Askande, which is Vata Dushta. Means Fenilam means it will be the Fodi, Aruna means it is the bright red color. This Krishnata means there might be the Krishnata, right dark color. Then Parushata, there might be the hardness or the dryness. Tanu, which is very thin. Shighram Askande. So these are the things. Means so this is the quality of a Rakta, which is Dushita by the Vata, which we can say just by taking out the Rakta, Dushita Rakta. So we have to take the Rakta out by any of the means of Raktamokshana, then we have to see these things. Right? And also, whenever there is the points which are related with the Pita Harita Shavata, right? Or Visram on this Visram Anishtam Pipilika marks on this. So the Pitata means the color of the Rakta can be given importance. So Pitata, Haritata or Shavata after taking out the Rakta. Means after taking out the means immediately after taking out the Rakta, but not after 1 or 2 minutes. Because whenever the this Rakta is exposed to the this atmospheric air, what happens is it will get becomes dark. So always you will get a dark color or the lightly bluish hue over the color. So we have to try it directly just after doing the Siravadana only. Just after doing the Siravadana only, directly, just immediately we have to think of these colors. Right? Then Gairi Kodaka Pratikasham, Snigdham Sheetalam, Bahalam Pichilam. So Pichilata, or when it is Visrata, when it is having the thickness in the this rakta, then it can be considered as the Sleshma Doshita Rakta. Sarva Lakshana Samyuktam Kanji Kavam. So all the things are there. Sarva Lakshana Samyukta. All these things if we are having, then it can be considered as the Sanipata Dushta. Dvidosha Lingam Samsustam. So two of the things if here. So why we have to classify or why we have to know that whether it is a Vata Dushita, Pitta Dushita, Kapha Dushita. After doing the Raktamokshana, again you have to treat for the some of the doshas will be left out. Right, after doing the Siravadana or after doing the Raktamokshana, some of the doshas will be left out. To remove the doshas, to remove the some of the left out doshas, we have to give any of the oral medications or samanaushadis. So when we are giving the samanaushadis, we have to think that this is the doshita rakta, vata doshita rakta is there, or pitta doshita rakta is, and accordingly, the shamana of that particular dosha can be encompassed in the treatment aspect later on in the samanaushadis. So what are the types of Raktamokshana? These are the basics, you know these things. So the Raktamokshana types means Shastrakrita and Shastrakrita we can do. Shastrakrita means by doing the Siravadana or by doing the Pachanna Vidhi, means where we are using it of the Shastras. Shastrakrita, it can be of the thing which is related with the Jalokas. Means in the Jaloka we are not at all using any of the Shastras directly. But sometimes we are also using the needle to prick out and have the suction of the blood. But still, it is considered the Raktakrita. So Raktamokshana types is there. And which are the contraindications of Visravana? So before doing any of the Raktamokshana, any of the Raktamokshana procedures, we should know contraindications. Where it is indicated, we all know the things that the indicated things are not so important. Where it is not at all done, where we should not do the Raktamokshana is very important. Right? So first we'll start with the contraindications of the Visravana, where the Raktamokshana or this Siravadana should not be done. So, Atha Visravyaha, Avisravyaha means it is Visravana is generally it is related with the Siravadana itself, right? So Sarvanga Shofa, if the person is having Sarvanga Shofa, right? So edema all over the body, generalized edema, there you should not do the Siravadana. Kshinasya Amla Bhoja Nimittaha. Kshinasya Amla Bhoja Nimittaha. So the person is Kshina already, and which is the edema is because of, or this which is because of the Amla Bhoja Nimitta. There also you should not do the Siravadana. Pandurogi, Arsha, Udara. So all these are the diseases wherein we should not do. It might be the Panduroga, it might be the Arsha, it might be the Udara, or it might be the Shosha, it might be the Garbhini Nam. Cha Shwayatavaha. So these are Asrabyaha. Means Garbhini is also contraindicated, Pandu is also contraindicated, Arsha is also contraindicated, Udara is also contraindicated. Then Balasti, you can see this word. So here it is Bala, Sthivira, Ruksha, Kshatakshina, Biru, Parishranta, Madhyapa. So all these means Bala means the person who is very angry, Sthavira who is having some of the figure and all. So Rukshata, when it is a Kshata, then Kshina, Biru. So Parishranta, Madhyapa. So Adva, Stri Karshita. Adva Karshita or Stri Karshita. Adva Karshita means after having the exertion for long walking and all. So Stri Karshita. So all these are some of the contraindications wherein we should not do the Siravadana. So for every one thing, means for example, if you are considering any of one of these things, right? So any of one of these things means you can see this word. So here the Kasa, Shwasa, Shosha, Prabhuddha Jwara. So all these things we are having, the person is having still not at all having any of them means energy. So it might be the Kasa, here it is. The Kasa if he is having the Shwasa, if he is having the Shosha, Prabhuddha Jwarata. So Akshepaka or Pakshakata, in these conditions, whenever there is an increased Vata is there, you can see that the concept behind doing all these things, there should be increased Vata, right? So after Suravadana, again we will be increasing some of the Vata will be increased. So there should not be any of the diseases which are related with directly the Vata itself, or where it's the Vata is going to aggravate. So there we should not ever do. And also in the bala stivira, in these things, why we should not do means they are contraindicated. Why it is because bala and stivira, in the bala they will be having maximum amount of the nutritive parts and they will be increasing. So whenever you are doing the siravadana, the Raktamokshana is done, then you will be suppressing the immunity. So should not be done in the bala or stivira, all these things. So for every concept we are having the things, means these are the contraindications wherein the siravadana should not be done, right? And you can see the next shloka, next slide it is. So contraindications of again Vebra Varshasu. Vebra Dina in the Varsha Kala in the Vidyastu. So Vidyastu Grishma Kaletu Shitale. So Vidyastu Diva means Vebra when there is the clouds is there in the Akasha, or in the when there is this Varsha Rutu is there. So in the Grishma Kala also. This means it is Grishma Kala is also contraindicated. Shita Kala means Grishma Kale to Shitale. Then Hemanta Kale Madhyane. So when we have to do the Siravadana, right? So it is in the Vebra Kale, Vebrasu Varshasu Vidhetu Siravadam. So here it is. In the Grishma Kala Shitala means he is giving the concept of the Shita Kala in the Ushna Kala. So whenever the Rutu is Ushna, whenever the season is Ushna, then you have to do the Siravadana in the Shita Kala. And in the Hemanta Kala, wherever there is a season is somewhat cold. So in that one, you have to do the Siravadana or you have to do the Raktamokshana in the Madhyana Kala. Shastra Kala Straya Smataha. So these are the three kalas wherein we can do the Shastra Karma. So Vebre Varshasu Vidyetu. So whenever there is a Vibrata, so Varshasu Vidyetu. And it is not at all continuously. Whenever it is raining, we should not do these things, right? So in the Shita Kala, Madhyana, there is Ushna Kala. And in the Grishma Kala, it is in the Shita, means in the this evening or the 6 you have to do. Then you can see the next shloka. Here it is. Just will alert these things. So it is Murchitasya, Atibhitasya, Shrantasya, Trishitasya cha. Murchitasya. In the Murchita also you should not do the Siravadana. Atibhitasya, whenever the person is having a fear of this, undergoing the Raktamokshana, you should never do this. Right? Na hivaranti sira. So in these conditions, what happens is na vahanti sira viddas. So sira viddasta tatha anuttita striyaha. So whenever the person is not at all having direct visible prominent one, and also anuttita sira, which is not at all elevated one. So then also you should not do the siravadana. Pratishiddhanamapi. So this is a very important concept. You can see this one. Pratishiddhanamapi means in these all contraindicated persons also, so it might be the Bala, it might be Sivira, and all these contraindicated persons, right? We can do the Siravadana. Pratishiddhanamapi cha visho upasar.
ಹಲೋ ಒಂದು ನಿಮಿಷ ಅದು ನಾನು ಆನ್ಲೈನ್ ಗೆಸ್ಟ್ ಲೆಕ್ಚರ್ ನಡೀತಾ ಇದೆ, ನಾನು ಹೋಸ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ಇದು ಅದಕ್ಕೆ ಕಟ್ ಮಾಡಿದೆ. ಇಲ್ಲ, ಯಾಕೆ? ನಾ ಇನ್ನ ಮಾತೇ ಆಡೇ ಇಲ್ಲ ಅವನ ಹತ್ರ. ಇವಾಗ ಜಸ್ಟ್ ಬೆಳಗ್ಗೆ ಸ್ವಲ್ಪ ಮಾತಾಡಿದ್ದಷ್ಟೇ, ನಿನ್ನೆನೂ ಮಾತಾಡೋಕ್ಕಾಗಿಲ್ಲ ನನಗೆ. ಏನೂ ಇಲ್ಲ, ಹಿಂಗಾಗಿದೆ ಏನು ಅಂತ ಸರಿ ನಿಮಗೆ ಅಂದರೆ ಅವನು ಬಿಸಿ ಇದ್ದ, ನಾನು ಬಿಸಿ ಇದ್ದೆ. ಈಗ ಏನಾಯ್ತು ಹೇಳಿ? ನಾ ಏನಿಲ್ಲ, ಅಣ್ಣ ಕಾಲ್ ಮಾಡಿದ್ರು, ಹಿಂಗೆ ಅಂತಿದ್ದಾರೆ. ಹಾಂ, ಏಕೆ? ಹ್ಞೂ, ಯಾರು? ಸಂಜಯ? ಹಾಂ ಹಾಂ, ಹ್ಞೂ ಹ್ಞೂ.
Letting the bread to be out, and after that we are using some of this churnas or some of the lipas and all those things. So prachanna with it is, right? So it can also be done with the help of the needle, or it might be done with the help of this 11 number braid, surgical braid. Straight lines can be kept over, or it can create a small bricks over these things. So how much the quantity of the Raktamokshana can be done? So it is having many of the references in the Shalyatantra. He says that So the contractive means balino if the person is balavan, right? Bahudoshastha if the person is having many of the doshas, maximum doshas, bahudoshastha. Vayastasya means person is vayastha. Vayastha means he is the age is also permitting him to do the siravatana. Vayastasya sharirinam in that sharira, in that person, param pramanam ichanti. Param means it is a shrestha pramana, means the maximum pramana. So what's the maximum pramana of this one is? Maximum pramana is it is a param pramam ichanti. Prastha is a pramana. So one prastha. Prastham shonitam mokshayani. So prastha pramana means generally we say that 768 ml. Right, so 768 ml is the one prastha, or generally it is a maximum pramana you can say. So 768 ml will be the maximum. So maximum we can take out the blood of about 768 ml. How this concept is revealed means you know that we are having totally of 5 to 6 liters of blood in that. So in the concept of hemorrhages you have studied that. So whenever the person is symptomatic because of the hemorrhage means the bleeding. If there is a bleeding, if it is more than 10% of the person is 10% of the whole body's blood is let out continuously, that immediate bleeding is done or immediate hemorrhage we see, then only the person will be having the symptoms, right? So maximum quantities here he says, so 768 ml is approximately a 4 to 10% of the whole body weight, means maximum that can be got. And what will be the 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 medium part, the medium quantity of the blood that can be taken or Seravadana can be done is, it is about half of this one, means it is Ardha Prastha, right? Half of this one can be done. And then if it is very minimal, then again the half of. So maximum quantity which you can today is, it is maximum is 768 ml he said, and the minimal quantity how much it is needed depends on the person's condition and different things, right? So maximum quantity should be not more than 68 ml. And also you can have this concept. Prastha is also Sa Ardha Triyodasha Pala. So Sa Ardha Triyodasha Pala, which is given by the Vakpata, this the Dalhana, which is a commentator, who is a commentator of this Sushruta Samhita Charita. So the 13 and a half Pala can also be the answer for this one, or it can be the Prastha. One Prastha it is of approximately 768 ml. Maximum quantity it is, and it should not be more than this one, right? Then what are the dimensions of Vedana or the instruments used, right? Needle size. So how much it is? How we can do the Siravadana? So Mampaleshu Avakasheshu Yavamatram Shastram Nidatyat. Mamsaleshu Avakasheshu Yavamatram Shastram Nidatyat means. So here, so Avakasha, which is Mamsala, means which is a very thick one, where you can have the many of the this stout tissue is there. There you can have this Yavamatra. Yavamatra is the one, right? Yavamatra, this Chirakanigran. So Yavamatra. And also Shastram Nidadyat. Ato Anyatha, if it is not at all Mamsala Avakasha, if it is not at all stout or thick tissue is there, then how much it is? Ardha Yava Matra. Ardha Yava Matra is generally, if you consider the Yava, means most commonly Yava is of around how much it will be, means on an average, the Yava will be having 3 mm of a diameter. Right? So sometimes it will be starting with the 1 mm to maximum of 3 mm. So the diameter of the Yava, right? 1 mm to 3 mm maximum. So when it is 1 mm, when we take the average of this one, it will be of 1.5 to 2 mm maximum. So on an average. So this part will be this much of 1.5 mm can be the this mm can be the quantity or the size which can be, we can do the Siravadana, means directly taking any of the surgical blade and taking out 1.5 mm of this making a incision is enough. So that how it has to be done means it is a Vrihi Matram va Vrihi Mukena. So it can be Ardhava Matra Vrihi Matra. So how much it is? Vrihi, complete Vrihi Matra can also be done, means 3 mm can also be done with the help of Vrihi Mukha Shastra. Then Asnam Upari, if it is Asthi Upari, Asnam Upari means over the Asthi, Kutarika can be used. So this will be the one of the this question which can be expected in the AIPGT also. So it is Kutarikaya, with the help of Kutarika we have to use in the over the Asthi, with the help of this Vrihi Mukha or with the Vrihi Matra we have to do. Vidyat Ardhayava Matram. So it is Ardhayava Matra. Kutarika Ardhayava Matra over the Asti, I can say. Means maximum how much it will be, means starting with the 1 mm to the maximum of around 3 mm we can have the Siravadana, means the incision. So for this nowadays we are using the needles, the different needles are used. So we are starting with a 16 gauge needle, right? 16 gauge needle, and also we are approximately we will be using around 50 most commonly. right? 20 kg needles also. But the in between we can use for about 18 kg needle, which is a pink colored one, right? 18 kg needle can be used. So which is approximately again same as that of this one. Means we will be giving it around 1.5 mm of the incision over the particular part. So this you can see the concept. Means we can modify the thing which is said here, Ardhaiva Matra or Yava Matra, 1.18 kg needle or 16 kg needle or 20 kg needles can be used for the Siravadana. And after that the Siravadana can be done. So causes of Alpasrava or Asrava. Why there is Asrava or Alpasrava? Tatra Durdine Durvidde Shitavatayor Asvine Bhukta Matre Skandayatvat Shonitam na Sravati Alpam Vasravati. So there Durdine Durvidde, if you are doing in the Durdina, means as the concept of this Rutu has been said, as the concept of times in a day has been said, if you are not at all for those things, and also Shitavatayor Asvine, if there is a Shitavata, so if there is a cold environment is there, Europe, Asvinne, without doing the Svedana, right? Before the Siravadana, you have to do the Svedana. Before doing the Svedana, if you are doing the things. Then Bhukta Matre, just after having the food, if you are doing the Siravadana. Then Skandhatva, so Skandhatvat Shunitam, na Sravati. So Skandhana will be there. Skandhana means there will be the formation of these clots, or there will be the formation of the clotting factors which will increase, because of which we can't expect the Srava of the Rakta. It is for the Siravadana. Mada Murcha Shamarthanam Vata Vinmutra Sangina. So if the person is having the this Mada and Murcha, if the person is under the unconscious state, so Mada Murcha Shamarthanam, if the person is having very exhausted, Vata Vinmutra Sanginam, if there is a retention of the Vata, if there is a retention of the this Mutra, and if there is retention of the this Vit. So Vata Vinmutra Sanginam, in the retentions of the stool, fetus, and all the urine. So there also we can't expect the Srava. Nidra Vibhuta, if the person is Nidra Vibhuta, continuously drowsy. But this Bhitana, Nidra Vibhuta, Bhitana. So beat the person, if the person is feared, then also you can't see the expect the Siravadana, means the blood to be letting out completely. So na asrik pravartate, the asrik Srava will not be seen. And you can see the next slide. Complications of Visravana. What will be the complications if you are doing any of the Visravana, means any of the this Siravadana or Raktamokshana, if it is done, what might be the complications? So Atyushne Atisvinne, Ati Ushne Atisvinne. If the person, if the means in the Ushna Kala, Ati Ushna Kala, or in the Atisvinne. So Ati Ushne, Ati Svinne. So when the person is undergone maximum amount of Svedana. Then Ati Vidhe, if the Vadana is at all not all Ati, means if it is very excessively Vedana, means if it is not at all followed with the 1 mm or 3 mm or 5 mm directly. Vigner Visravidam Ati Pravartate. So Vigner Visravidam Ati Pravartate. Because of Agnir. Agnir means it is Agnata. Because of the lack of knowledge or ignorance, we can have the Visravana to be Ati Pravartate. Maximum amount of blood will be let out. Tatta Ati Pravrutam. So that Ati Pravruta Rakta, what it does is Shiro Abhitapam. So it produces the Shiro Abhitapa in the Shiro Abhitapam, Andhyam. Andhyam means the person may have this loss of the sight. Andhyam, Adhimanta, Timira, Pradurbhavam. So Adhimanta and Timira, which are generally related with the disease of the eye. Right? Adhimanta, this Timira, Pradurbhavam. Dhatu Kshaya can also be seen. Dhatu Kshayam, Akshepakam. Akshepakam can be seen. It might be the convulsions and it might be fits and all. Akshepava, Daha can be seen. Right? So which is again Akshepakam Daha. So when you consider this Daha is actually the increase, means whenever the blood has been let out quickly. So Daha will also be seen. Daha Pakshagatam. Pakshagata will also be seen. Pakshagatam, Ekanga Vikaram. So it is the hemiplegia or any of the paraplegia of means Ekanga Vikara can be seen. The Hikka, then Shwasa, then Kasa, then Panduroga, then Maranam Chapadati. Means if you are not at all following the things. So it is Siravadana or the Raktamokshana is not at all so simple as we think of. But whenever if it is not at all ignorance, because of the ignorance of our sense. So what if the Siravadana has been done, or if the Raktamokshana has been done, then what happens is these will be the complications. Because of these things, the patient can even die over the table itself. Right? So always doing Siravadana, you should be very cautious. Right? Then Purva karma. What is the Purva karma for doing this any of the Raktamokshana? Tasma na shite, na ati ushne, na svinne, na ati patite. Yavagum pratipittasya shunitam moksha vishak. So yavagum pratipittasya, see this word yavagu. Yavagu pana is a important thing which has to be given to the persons before undergoing the Siravedana or before undergoing any of the Raktamokshana procedures. Yavagum is generally we are using the Tila Yavagu. Tila Yavagu is generally used, or along with the Tila Yavagu, Tila Guda is also mixed so that the person can have the energy and all. Only Tila, if it is given, it will be increasing the this pitta and all. Right, so that if the increase means generally before doing any of the virechana, also we'll ask the patient before doing the virechana if tomorrow the patient is undergoing the virechana, then what will do is the patient will be asked to have the increasing pitta aharas, pitta kana ahara viharas, like amla dravya or katu dravya, ushna dravyas will be given. So like that here also we are increasing the pitta by giving this tila yavagu. Along with that, some of the means practice in the practice we are saying that the guda is also mixed with the tila and will be given so that will feeling energized. So whenever the Guda is added, the person will be strong and directly the hypoplasmic shock will not at all be seen because of this Tadita Gula. So Tila is the this Yavagu is the given Yavagum Pratipitasya. So without Yavagu Pana, you should not do the this Siravadana or any of the Raktamokshana Pratisas. Samyak Visravana Liksam. What are the Samyak means the best Visravana after Samyak Visravana? What are the things that can be expected is Samyakatva Yata Raktam Swayam Eva Avatastate. So here it is he's saying about the Siravedana. Okay. So Siravedana it is. Swayam eva avatishtate means if you are taking the correct instrument, if you are pricking the point, or if you are making the incision correctly with a standard size which has been set, shuddham tada vinjadiyat. So then it will stop on its own without any of the things. Means if the dushta rakta is there, how much the dushita rakta will be there, it will come out, and after that it will stop on its own. Right? So it will stop on its own, so it will get coagulated. So shuddham tada vijaniyat samyak visravitam chet. Shuddham tada vijaniyat. Then you will consider that samyak vijanita. So samyak shuddham tada vijaniyat. After that it is considered as to be shuddha. So if it is samyak avasthita means samyak eva swayam eva avatishtate means it will stop on its own. Then you have to consider that it is samyak visravadana. Then samyak shastra nipatena dhara yava sraveta. So this is about the Siravedana. How the Siravedana is done after doing the Siravedana, the dhara it should be in a continuously free flowing blood should be there. So it is dharaya means the stream of the blood will be continuous. It is with the stream which has to be flown, right? Sraveda srak muhurtam ruddhatishtecha. So here there is a reference which says that muhurtam ruddhatishtet. Muhurtam means after one muhurta or maximum time is one muhurta. Within one muhurta it should stop. Right? Muhurtam ruddha tishtecha suvidham tanviradishet. That is considered as a suvidha. Means here also it should, he is saying that swayam eva avatistate, and here he is saying that ruddha means muhurtam ruddha tishtecha. After one muhurta if it is stopping also. So then it is done. So how much the quantity of the, so you can think that within 5 to 10 minutes also you will get the maximum amount of the quantity of the blood which has been let out. So then you can stop the doing the Siravedana, or you can stop the letting out the blood. So Raktamokshana can be stopped at any of the points if you think that the patient is not at all agreeing these conditions. Some different types of Raktamokshana as it is Sira Vishana Tumbestu Jalokavihi Padestata. So Sira Vishana Tumbestu means it is a Siravata is the first type as we discussed. So completely in the previous slides, I discussed only about the Siravedana. So why I discussed only about the Siravedana, because at the maximum that complications which can be arised, it can't be arised because of the Vishana or Tumbi or the Jalokas. Right? So most of the times the complications will be arising. We will see the complications while we are doing this Raktamokshana. The patient will become faint, they can become unconscious, they can have the vomiting, they can have the loose motions, or they can fall on the phone, or they can't respond even. So all these complications will be seen when we are doing the Siravadana. So if you are able to manage the complications, these complications has been managed. If you are able to manage the complications, then it is very easy. So Siraveda, I said that maximum extreme points, which are the contraindications are there, extreme points has been said for the Siravedana. So in detail we studied about the Siravedana. So now it is about the different types. It is Sira Vishana Tumbestu Jolokavihi Padestata Avakadam Yathapurvam Mirharetushta Shonitam. So Siravedana can Avakadam means deeply sighted. If it is, then Siravedana is the best one. Then it is a Vishana, then it is a Tumbi, or it is a Jaloka and Padestata. So Pada means it is the Prachanna and all. So Avagade Jalokasya, this is also one of the standard reference. Avagade Jalokasya, if it is the Avagada Rakta is there, right? So Avagade Jalokasya, Prachandam Pinjititam. If there is a Pindita Raktam, so we can consider it as a hemangium and all. So there we can go for the Prachanda. Sira Anga Vyapake. So if the Dushita Rakta is Amba Vyapaka, all complete body is having the Dushita Rakta, Sira Amba Vyapake Rakte, Shringa Alabu, Twachistite. Shringa and Alabu can be used when it is Twachistita. If the doshas are there in the twacha, then you go for the Shringa and Alabu. So Avagada, in that one, Jaloka can be used. Prachanda, it can be used in the Pindit Rakta, in the Imajosan. Sira Amka Vapake Rakte. Taksti, Shringa Alabu. So these are the things. What is the mode of action of Raktamokshana? So before going to the mode of action, just I want to say about the different types of the Jaloka, which is different types of the things which are related with Shringa, Jaloka and Alabu. So maximum concentration which I gave is here, it was only related with this Siravatana. So why it is? Because the concept of Jalokacharana. Jalokacharana can be done very easy procedure, which can be done without not seeing much of the complications. But unless and until if in some of the patients in the as a complication seen that there might be the itching and there might be edema and the patient might be suddenly undergoing the severe anaphylactic shocks and all. But still it is very rare, right? So when you are using the Jalokas. And also while using this the cupping therapy, which is a modified form of a cupping therapy. A cupping therapy is a modified form of this the alab and the shringa, which were used in the olden days. So why we are not at all using this Jaloka and this alabu? Because of the aseptic precautions which are to be taken while doing these things, or we can't use the same Jaloka, this same shringa, or the same this alabu for the different persons. So nowadays we are having the cupping therapies, which are which can be generally sterilized also even. So those cupping instruments we are using nowadays, right? So the Jaloka is also the best procedure where it is when it is having the pitta dosha. So this the shrinka and all, those can be used in whenever the person is having the drain and all, right? So alabu, so in the kapha doshita. So there we can go for these things. So after knowing all these things, right? After knowing all these things, you might have seen that how the concept of this Raktamokshana can be helpful in many of the diseases. Right? In many of the diseases means he said that the person who is having the regularly that undergoing the Raktamokshana regularly or Siravatana regularly, then he will not at all be suffering with the skin this Toktoshaha, Granthaya Shofaha, Rogaha, this Shonita Jaste. So you will never ever encounter the diseases in your lifetime. So how he is saying these things, and also we have seen that the Raktamokshana, the clinical implications of the Raktamokshana, we seen in the case of this Gridrasi, wherein in the Gridrasi, in the sciatica, we are doing the Siravatana, and the magical therapy it is. We will just after doing the procedure itself, within seconds, a fraction of seconds, the person feels very light, and the pain, the person who can't, the SLR will be only 10 to 20 degrees for the person. Then also the patient will be having, he can able to lift the person, and the degree of the angulation will be increased up to 90 degrees. How it is? So there should be some of the actions, some of the things that can be said that in case of the Siravedana or in case of any of the Raktamokshana procedures, these are the things which can be it can be there, which will be relieving the pain and all, or which will be increasing this Varna and all. So which concept it is? So according to Ayurveda, we have the two concepts, right? So in Ayurveda, we can say that it is the Pitta dosha. Pitta is a dosha which is generally increased because of any of the pittaja conditions. We can go for the Raktamokshana. Pitta, if it is means Rakta, if it is let out, the Pitta will also come down, and because of this, the pittaja vadis can be easily treated with the Raktamokshana, we can say. And also, as in the Panchabhautika concept, we've seen that Visrata Dravata Ragaha Swandanam Lagutatata. So in that concept, again, which part of the Rakta is Dushita, no? It will be generally increased. So if you are taking out the Rakta completely as a whole, some of the part which is having its maximum predominance, that will also come down. Means the first concept is what I'm going to say is, first is thing is related with here you can see this one. So first thing is, just whenever we are doing the Raktamokshana, as I said, the Pitta can be generally a Pitta, if it is a Pitta will come down, right? So Pitta is a main victim, which can be which can we can use in the pitta javadis. And as the shonita is also related with the pitta itself, so shonita javadis, so the rakta javadis or the shonita javadis can also be easily treated with the this Raktamokshana, because the dushita shonita will be there. Dushita shonita can be easily removed because of directly removing the rakta itself, and the shonita, the dushita shonita will also come down. And as I said, it is the panchabhautika concept. Panchabhautika concept is that whenever we are doing this Siravedana, the dosha which has been increased maximum, means in the Siravedana we are taking out the dushita rakta, we say. So not only the dushita rakta, we are also taking out the healthy rakta. Right. So which is the rakta which is prakruta, which is the sthira, which is the gunavan, that rakta will also be let out while taking out the dushita rakta. So the thing which has been said, as I said, it might be the visrata, dravata, ragata, or spandarta, means pantakoji concept if you see. So the point, which is the point of the predominance, which has been increased at its maximum, or which has been dushita at its thing, so that can be let out. So if the dushita thing has been left out, then what will do is, means consider the 100% of the rakta it is there. So in that 100% of the rakta, 40% of the rakta is dushita considered. Right? So the 40% of the rakta is dushita. So to take out this 40% of the rakta, you will be letting out around 10%, maximum of 10% of the
Somewhat
rakta
practical
in this one.
shown.
So when you are taking out maximum 10%, then again in this also 10% you will be taking out. But not only the 10%, but along with the 10%, 20% or extra amount of the blood will also be, means dushita rakta can also be taken out. How we can say this concept is just generally. So total of 30%, how we can take out the rakta means, so total of 40% it is dushita in our body, consider, right? So in that 10% of the blood will be letting out. 10% of the blood means maximum quantity which has been said is, as I said, it is approximately 768 ml is approximately around 10% of the total volume of the blood. So 10% of the blood will be letting out, means 10% of the dushita rakta will be we are letting. Along with the 10% of the dushita rakta, as we are giving the tilaguda yavagu pana, right? So yavagu pana if you are giving, after that what happens is yavagu will be increasing the dushita pitta, or it will be increasing the total amount of pitta. So increasing the dushita pitta means it will be increasing the dushita only. So why it is only increasing the dushita
What
means,
is the
the
one
one which is dushita,
this?
the ka vaigunyat vyadhistatrupa, where there is a vigunata of the ka, there we will be having the increase or decreased amount of the this accumulation of the
Put
doshas.
it.
So whenever you are giving the yavagu and all, so there what happens is again it
ತಂದಿರ್ತಾರ
will be
ಅವರು
increasing the dushita
ಲಾಸ್ಟ್
rakta.
ಟೈಮ್
Right? So overall rakta will also be increased. Along with the overall increased rakta, you will also be increasing the dushita rakta. So again 10 to 20% of the rakta will be increased, means the dushita rakta will be there. So that dushita rakta we are letting out or we are taking out. And along with those things, after the left out 10% of the days, means completely we should not take out the 40%, means complete dushita rakta can't be taken out only by doing the siravadana.
ಬಟ್ ನಾವು
Right?
ಹೆಂಗ್ರಿ ಮಾಡ್ಬೇಕು
So the only the left out 10% of the doshas which are there, no, so those has to be treated by using the any
ಈಗ
of the
ನೋಡ್ರಿ ಈಗ
shaman
ಮಾಡಿ
aushadhis
ಹಂಗೆ
related with the
ಯಾರಿದ್ರು
any of the things.
ಬೇಕಿದ್ದಾರೆ ಕೂಡ
So maximum quantity of the blood can be taken out, that is 758 ml, and maximum amount of dushita rakta we are letting out, so that the person will be having the relief from the symptoms which are related with the dushita, or which are related with the rakta dushita. Here it is, right? So pitta dushita can also be treated, and also rakta dushita can also be treated. So it should not be ati sravana. Ati sravana will again increase the vata, right? It will again increase the vata, and you can see that after doing the siravadana also the persons will start feeling heavy pain and all. So why it is? Because it is the quantity of rakta which has been left out. It is not the adequate quantity of the rakta. So how much adequate quantity of the rakta has to be let out? It again depends on the physician, and again it depends on the this doshas of the person. Right? So individually you have to think of with how much it has to be let out, and then you have to go for. So before in the starting phase you should never go for maximum quantity of the blood which has been let out. So let's start with the 20 ml, 50 ml, 60 ml, 100 ml, and maximum 120 ml, 150 ml, and maximum amount of the blood which can be let out is around 180 or 200 ml or 220 ml. That's all. So maximum amount of the blood which can be kept. But in the experience, after going through the experience, and if you are having the the fear, or not having the fear that of you are unable to manage the complications, then you should not do more than 200 ml or 220 ml. So if you are well enough to or accustomed enough, or if you are well equipped to manage any of the complications which can be there because of the excessive amount of the blood which has been left out, which can be just have the symptoms of the excessive this the hypovolemic shock. So if you are able to manage the hypovolemic shock, or if you are equipped with having the management of the hypovolemic shock, then you can maximum amount of the blood which can be left out is around 300 to 400 ml can of the blood can also be let out. Right? It should be under the decreasing. And when it has to be let out, means the person should also be balavan, and also the person should have the
Something out of
maximum of
herself.
doshas. So then only we
No,
can
ma'am, he's on
do
now.
this amount of the 30 ml of the 300 ml of the blood can be let out. So this is about the mode of action of Raktamokshana according to Ayurveda. Means Pitta dosha will be regulated. This Shonita or the Rakta dosha can also be regulated. So whenever there is the Pitta associated symptoms of the Vata, whenever there is Rakta associated symptoms of the Vata, whenever there is a Pitta
And
associated symptoms of
he's
the
calling
Kapha, or
16.
Rakta associated symptoms of the
He told us.
this Vata, then those can easily
ಅದ್ರಲ್ಲಿ
be
ಒಂದು
taken.
ಸ್ವಲ್ಪ 30
So
20
Pitta is also one of the things which can be joined with this Kapha, or it can be joined with
Whatever you
the
don't
through
do,
the Shonita.
it's
Right?
no use.
So in all the diseases, means in the three doshas, we can go for the in all the three doshas, we can go for this the Rakta Mokshana, right? Very prominently and which having the good results. So this is the concept which can be said
No,
in terms of this
basic assistant
the
professor.
Ayurvedic concept of Rakta Mokshana. So now we will go through the different concept. Different concept means the concept which has been said
Okay.
for the or the modern concept. How we can say that the Rakta Mokshana means Rakta Mokshana will be there, will be
In that
decreasing the
critical
doshas, or
analysis
it
of
will
the
be improving
motion
the
we
health
have
of the
given you.
patients. How
What?
it is. So we will consider a single disease, right? And we will go through in many of the Vataja conditions. In many of the Vataja conditions, the Rakta is indicated, means the Rakta Mokshana is indicated, right? Or whenever there is a pain, whenever there is a daha, not only the pittaja symptoms like daha and the osha chosha paridaha all, but in case of the vata, whenever there is an increased amount of vataja conditions like this pida and all different types of curing pedas. So in the vataja conditions also we are using the Raktamokshana. How it will be reduced? So first disease we consider is how the Raktamokshana or how the Siravedana will be helpful in case of doing this Gridrasi and all. So if the person is coming to you with the symptoms of Gridrasi, and like the patient unable to walk or unable to lift his leg and unable to lift the this upstairs and all, so the pain will be radiating from the this loin region to the back to the thighs or to the popliteal fossa or to the calf regions or up to the even up to the this the toes also, the great toes also. So there in these different conditions, right? So if the person is coming to you, then if you are doing the Siravadana classically means before the Siravadana, what we have to do, we have to ask the patient to have the Yavagupana, and before 1 or 2 hours before the procedure, and then after that we have to ask the patient to have the Snehana and Swedana in the localized part where you are preferring to do the this Siravadana. Siravadana is generally preferred in case of according to Sushruta, it is in and around the this foreankula, in and around this knee joint. We can do the Siravadana, or most preferably we will be using this the ankle, the gulfas and the for doing the Siravadana. It might be the Charakas version, it might be Surasha version, whatever it is. We are preferring to have the Siravadana in the great saphenous vein, whether it is in the ankle region or whether it is in the it might be in the this knee reason, right? So we are doing this rather. So what we'll do is we'll ask the patient to have the Yavagupana, and after that we'll do the Snehana and Svedana, and after that we'll ask the patient to have the Siravadana. So this is the concept. So after the Siravadana, just after doing the Siravadana, the person will be completely get rid of the things, as I said in the previous just only that the SLR, if the patient is unable to lift his leg for about 10 to 20 degrees also, he can lift his leg up to 90 degrees. So how it can be done, or how it can be done is how it is possible means we will have a mode of this the mode of action of this Rakta Mokshana. So you know the concept of the neurotransmitters. The first concept what I would say is, right, the concept of neurotransmitters. You know the concept of the neurotransmitters, right? The concept of neurotransmitters means it is the concept which is
all
related with the
along with
things which are
they
there
will
for.
also do. Even
For
though
example, the natural painkillers what will serve.
they will also
So what are the
enter
natural painkillers means it might be the endorphins or dorphins. So
and
any
it
of the dorphin drugs,
yeah,
it
all
might be
which
the
has
endorphins or
end
durodorphins
of
or
it
any of the
like
dorphins.
that.
So endorphins are
He
the
like
pain regulators or painkillers, natural analgesics these are. So when they will be released? When they will be released means whenever we are having a severe form of pain, right? So whenever we are having the severe form of pain, acutely they will start releasing, right? So when they are released means when the patient will be having the pain, and there will be the consider that the patient will be having the released endorphins, right? So when the person is having, or the patients are having released endorphins earlier, again if you are doing the Siravedana, you will be stimulating
Now it will become
the endorphins to have the maximum surge of the endorphins at the time.
only one I
So
think.
how it will be seen means there is a concept of the pain mechanism, or the this concept is the same
Third,
applied when we are doing the acupuncture therapy and all. So acupuncture will also
third
be doing
online
the
hub.
same thing. Means we are directly doing the Siravedana. Siravedana means pricking therapy. Again, we are inducing the pain, which is not at all superficial than over the skin itself, but also including the
That too,
vasospasm.
how
Means
it
that
should
it
do
is
it
also related
very
with the
peculiar
this the
mountainship with it.
constriction of the vessels. Means we are also piercing the vessels. So there generally what happens is there is
So
maximum
I
surge of
thought
release of whenever we are touching out the small smooth muscles of the this the vessels. It might be the veins or it might be the arteries. So if you are doing the Siravadana, we are generally doing the Siravadana not in the arteries, it is in the veins itself. So whenever you are touching the veins or whenever you are piercing inside the veins, there will be maximum surge of release of the endorphins. These endorphins will be generally meant for having the release of the pain, or the pain will be completely relieved of because of the endorphins which are there. So these endorphins will be having its maximum surge for about 24 to 48 hours. So the person will be feeling of
time
about
itself is not
after
going
the just after the procedure, the person the patients will be feeling about the means lack of pain, which will be there because of this.
what
About
he's explaining
28 to
is
48 hours, they will be having the
understanding.
relaxation of the pain. And you know the concept of the chiropractic. Chiropractic is a practice which is generally used to have the means, they will be fixing out the spasmed muscles. How they will be fixing the other muscles? Just by stretching out the muscles. So why we will be having the pain in the Siravadan? We say in the Gritrasi or in the sciatica is there will be spasm of the muscles. Along with the spasm of the muscles, there will be compression of the nerves. So why there is a compression of the nerves? It might be because of the disc herniation, it might be because of the disc prolapse, or it might be because of the disc compression, or it might be this endothelial indentation of the sacs. So all these things will also be related with the spasm of the muscles. So whenever there is a spasm of the muscles, because of all these conditions, there will be the spasm. This spasm will be leading to the
Last time
severe
you
pain in
told
the
that
patients.
see stethoscope.
So whenever there is a chiropractic, means in the chiropractic also we seen that the patient will be feeling relaxed just after doing the any of the forceful extension movements which they are doing. So how it is means again they are releasing the spasm. So these endorphins are also meant for the relaxation of the smooth muscles, not only smooth muscles, also the relaxation of the skeletal muscles. So when the skeletal muscles are relaxed completely, then the spasm will be lost. Where there is no spasm means the spasm will completely lost. You can touch the patient's back in the this liver triangle, this the muscles which are there in the this iliac muscles which
But
are
no
there.
one is
So you
telling
can
family.
touch the patients. There will be severe spasm. The tenderness will be there. In the Vishwashi also we are doing this the Siravadana in the this cubital fossa. So there also you will be having that the patient will be having a relaxation of the pain. Right? How it is means there will be spasm in the this the pressure muscles and all these things. So the spasm will be
Interview was
relieved of
there means now
completely
also
because
I
of the
can
release
go
of the
and
endorphins.
come.
These release of endorphins again will release the maximum amount of surge of the the dopamine. So how the dopamine will be released? Again, they are the mood regulators and they will be giving the pleasureful lives. So when there is a complete relaxation of the spasm of the muscles is there, so then again there will be maximum amount of release of the dopamines. These dopamines are again natural painkillers. They will be keeping the person's mood to be very active, and they will be reducing the pain. Means endorphins, which are neurotrophins or the endorphins drugs, and along with the dopamines. So serotonin will also be released, which will be regulating the temperature of the body, which will again normalize the things to have the normalcy. So whenever we are seeing that, whenever the patient is having the relaxation of the pain, no pain is there just after the intervention, it is because of the neurotransmitters, the endorphins, or because of the dopamine, or because of the serotonins which are released just after doing these things. The second concept is there. Second concept is related with the theory of erythropoiesis. So erythropoiesis means the increased amount of the blood in the bone. So the erythropoietin will be the hormone which is again regulated by the kidney and again regulated by the liver and again regulated by this the bone marrow, right? So red bone marrow it is. So there will be the formation of the blood, new blood. So whenever there is the different hypovolemia is there. Hypovolemia is there. Hypovolemia means just if there is a loss of blood. Loss of blood means here we are saying that around 100 to 200 ml of blood is lost. Then there is also the concept of the mechanism of wound, right? So how it is means it will be in the wound also we'll say that there is a stage of inflammation, there is a stage of contraction, there is a stage of the reepithelialization, all those things. So the same concepts will also be followed here. So how it is means whenever there is a Raktamokshana, there will be hypovolemia. Means the total amount of the blood will be lost, will be of a rated of approximately of 100 ml or 200 ml or whatever it is. So there will be maximum amount of surge that the excessive amount of the blood RBCs will be lost out. So it increases, it sends the muscles to the CNS and it will be releasing maximum amount of the RBCs to be dead out. So when the RBCs means when the RBCs are letting out means when the count of the RBCs are coming down, it will increase suddenly, right? So the erythropoietin hormone will be stimulated and it will be increasing the erythropoiesis. Erythropoiesis is for the RBCs formation. New RBCs formation means it is the new oxygen carrying capacity of the body. So new oxygen carrying capacity of the body means maximum amount of the new RBCs are there, which will be maximum 100% of the oxygen carrying capacity will be increased because of these things. So when the maximum quantity of the oxygen carrying capacity of the RBC is increased, right? This is not at all, we seen that it is not a sudden change, but it will be reacting out on 24 hours. Maximum amount of the RBCs will be released or RBCs will be produced because of the reticuloendothelial cells. So these reticular endothelial system will be acting and it will
Then
be
you joined
producing the
after
new RBCs.
last
So again,
December.
in the previous concept, we seen that 1 to 2 days of the
November
pain
14th.
relief will be there,
First question,
and after 1 to 2 days, this poiesis, this erythropoiesis, which is maintained, it will be maintaining the normalcy. So how much it is only just by taking out the 100 ml of blood will react and it will have the maximum amount of the RBCs in the body. Yes, it is definitely. So kidneys, what they will think that the main thing which has to be stimulant for the release of the erythropoietin is the hypoxia for the kidneys. So the kidneys, if it is there, means hypoxia of the kidneys can even
Silly number.
in the brain can even be formed just by taking out
What's
50 to
going
100
on?
ml of the blood also.
Don't know.
So brain, if 100 ml of blood is lost, what the brain thinks is the maximum amount of blood may ooze out suddenly, and we have to prepare it. So there will be maximum amount of stimulations through how the erythropoietin. So erythropoietin will be stimulated, and these erythropoietin which are stimulated, it will be releasing the maximum amount of the endocrine epithelial cells. The reticulocytes will be released, and these will be formed to the new RBCs. So new RBCs means maximum amount of the oxygen carrying capacity, which will be again nourishing to the hypoxic and the spastic cells or the muscles or the tendons which are stuck out there. So again, because of these things, there will be release of the spasms, and again the patient will be comfortable. So generally, what we will do is we will be doing these procedures weekly once for 2 to 3 sittings, so that we can maintain this continuous procedure. But classically, if you go through the Raktamokshana, it is also one of the this Shodhana procedure. So generally, there should be the gap of around 15 to 20 days after doing the Raktamokshana. But in the clinical practice, we seen that maximum means weekly we are doing the Saravadana and we are getting the maximum good results. And even the patient's recurrence rate is also very less as compared with the other things. So after this, the shamanosis can also be prescribed and we can go through. Means in this one, the main important highlight of this seminar or webinar is a mode of action of the Raktamokshana, how it is. Right. So here we have the two concepts of neurotransmitters, which are the opioids, and also the second concept is about the formation of the erythropoietin. So these two concepts will play an important role in the reducing or in making the normalized natural analgesia to the body, and it will be helping to the formation of these things. So this has been under the process of the this article has been under the process to have submission or to have this rescheduling of this article will be published very soon. So which is very important. What I feel is, so next thing is about the videos for you. So as you all are the maximum students are UG students, it might be somewhat extra thing that the mode of concept of Raktamokshana is not at all so important for you. But still, what I feel is if you know the concepts behind doing any of the things, the intention behind doing something, the things is very important. So if your intention of knowing the things, if you are doing the Siravadana, if you're intending that these two-thirds will come down, these are the things which will come down, then definitely you have the confidence. With the confidence, you will do the procedures. So you will do the procedures, and you will definitely see the good results. So intention behind doing anything is very important. So if you know why you are doing the things, then you will be confident and definitely you will be getting the good results for these things. And if you're not really getting any of the results, then you will start thinking of the things which are left out. right? So know the things better and have the practical knowledge better.
Doing
Then you
PhD.
have to go for the clinical importance of these things, right? So there are some of
For
the
you,
videos for you,
link
which are you can
MS
have this
Ayurveda.
link and you can have the things. So just I'm showing some of the images also.
Also, some other degree I noted.
It was very big, ma'am.
I
Not
couldn't
able
read. I
to
was standing
tell
there.
you.
No, actually, you should not do like that. Exam hall, no. Next to that, I was standing in a telling.
Ah.
It is not good. I think this lady should understand.
I came here and I asked ma'am, welcome speech who is doing? Because Sangapur sir is only. No, Anisha ma'am is doing. Means Anisha ma'am only told me that Sangapur sir was only. No, I informed her. She will come
Already
for
Jagadish was prepared for that.
again lost network. See ma'am, what is this recording?
Jagadish was prepared for that. Then
Go or the things which are related with these things.
student.
So it is the Shwitra. In the Shwitra persons, we are doing the Prachanda. You can see this arrowed lines here, right? So the Rekha Ruju incisions means the straight incisions has been taken over the particular part of the where there is a hypopigmentation of the skin, and there we just applied the Trifala churna or any of the fine churna just to have the irritation of the skin. And here we have applied after this Prachana Vidhi, we did the Jalakavacharana. Right? So both the things means Jalakavacharana has been done along with the Prachana Vidhi. Prachana can be done in any of the conditions wherein there is the clotted formation of the blood is there, or where you feel that there should be the need of irritation. For example, in the alopecia area also. Means in the Indraupra we can do the Prachana, means multiple straight linear incisions can be taken, and over that any of the irritant powders, coarse powders can used. Most commonly we can use the Trifala, or you can also go for the Devadaru or any of the Trikatu Dravyas, any of these things which will irritate the skin, and there will be the formation of the new hair follicles in the Indralupta also, which is the alopecia area also, or in the Switra also we can do, or in the where there is a hyperpigmentation over the faces or melasma, any of these things also we can go for the this one. So where there is a twak related thing, as it is indicated, it is indicated in the Prachana is indicated in the twak related things. So Prachana, if you are doing the Prachana, the Twakkagata doshas can be reduced off. So multiple 3 to 5 sittings we can do, and we can have the good results over these things. Right? So this is about the Prachana, and which is a clam, which is this is the image which I'm showing is about the Alabu. Alabu, we are not at all using the Alabu right now because of non-sterilizing the things, and not at all easily availability of these the terms and all. So we are not at all using the Alabu. But still, in many of the classical practitioners, they are using these one. But there is a risk of transmission of any of the transmitting diseases or communicable diseases are there, or sexually transmitted diseases which we can see. So HIV, HBsAg, HCVs. So all these are virals. They can be transmitted through the blood itself. So before doing any of the things, be sure that we are using these things as a disposable one. We are not totally using these things again and again over the different patients, individuals, right? So nowadays we are not totally using it, but we are using the modified form of this alava, so which can be called as very famous in the Unani, right? So they are practicing it very well in the Unani people. So they are calling it as a hijama and all, right? So this hijama here, I'm showing the image of this hijama, which is this cupping therapy, what we'll say. So cupping therapy it is a wet cupping therapy, means directly letting out the blood here. So they are calling it as a dry cupping therapy without taking out the blood. So small pricks or small incisions which we are doing in the Prachana, no? Like that they are doing, and after that we are doing this one. So means here also the blood letting will be done, which is the modified form of the Alabo, what we can say, or a modified form of the Shunga, what we can say. So this can also be better practiced in the things which are related with the skin, and also in the many of the spasm related things where there is a pain and all, we can use these things, right? So these are some of the things which are related with the Prachana and all. And you can also have this one. So just it is around 12:29 the time is. Just I'll take 2 more minutes, couple of minutes of you, right? So that I can show you the videos of things which are related with the Siravedana. So before this opening of this video, so if you are having any of the questions or any of the queries, if you have, you can ask me. We can have a discussion over questions, or you can send the questions to the organizers. They will let me know the question so that I can answer those things. So if you are having any of the queries, then you can ask me.
From we having this Panchkarma files some center with
Thank you, sir. Thank you for wonderful and informative session. Now the session is open for discussion. All delegates, any questions is may you can openly ask for.
No, I told you.
because
That whole hall was having this sound.
And all delegates from outside STGMs are requested to send your name and mail ID to the given number in the chat box.
I think that one
YouTube videos will be streaming in on
This
alternate.
some video.
Now who is getting it?
Who's that?
Actually, chat box very chat box.
How it is under professor's name? First laptop. Huh?
No one question.
Only that.
No one
Anyway. Where is Sirendra sir? He should ask us to know. Sorry, Siri.
You only ask any question, one question at
I
least.
didn't hear only, that's the problem.
What is the doubt you are having? You ask what? Just only you can ask.
So here you can see this is a video which was done over the patient who was having the varicose vein in our college. So in this patient, the patient was having this grade 3 varicose veins, and he was having the discoloration of the skin. Along with that, he was having the Kirani shop merchant, and as he was having the discoloration of the skin and also the visible varicosities, he came to us, and he's of around approximately 54 years of a male patient. So we did the Siravada. So you can see how much the maximum quantity of blood has been taken out. So you can see, hello, you can see this one. So
Okay,
here it
okay.
is a, you can see,
You usually do it, only
so where you can see this one.
Minor okay.
And
Patient is a local history and like patient only.
So you can see the small web veins also here. On this also you can see this one, varicose visible varicosities. It's having multiple borodes. This is needle of around 18 gauge needle, which is a pink color one. You can
Kaliya.
see, you can see the free flowing blood which is coming out. Now you can, according to Ayurveda, can differentiate with the, which is the red color of the things. Color, you can see the color of these things and you can say. It is not the frothy one. Here it is the place where it is kept out. So it is frothy, but it is a dark crystal one. The dark color is there, right? So here this is complete having this syphilis-femoral incompetence also. After doing the Siravadana, he was very comfortable and he felt that the complete it was very multiple times. And now the patient is under the follow-up also. And nearly twice we are doing this Siravadana. The patient is coming for the Sita, what the patient will do. And now he is completely normal, right?
Thanks.
Question that is reduced of the symptoms, and
Stop. YouTube videos
let's
reloaded.
see another video of applying the Jalokandam. So before doing any of the Jalokacharana, what we'll do is we will have the patient to have been said or to be grateful for this Jalokacharana. We will select the patients. And what we'll do is here we see this is Jaloka application has been done in this video, has been done for in the case of acne, right? Acne vulgaris.
One
So in
question.
this patient also we did this Jalokacharana.
Mode of action
Jalaka
of
has been applied.
cracked foods.
Okay.
So before applying the Jalaka,
Food
we will have the activation of the Jalaka, putting it in the keeping shade filled with the Haridra, and we'll keep for 3 to 4 minutes.
Sorry to interrupt you, sir. One
After
question
that,
is there
we will
in chat box. Mode
have
of
the
action of
this
Siravada in food cracks.
mode of action. Yeah, it is generally in the Vipadika, in the Vipadika, there is this concept of Siravadana is there. In the Vipadika, we are doing this. Or in any of the cracks also we are doing. How it is means how the action of this Siravadana isn't there in this cracks means generally the concept of Rakta. Here also wherever there is a wound, as I said in the while explaining about the mode of action of this the Siravadana, wherever there is a wound, it will be restoring the wound. So why the Siravada is said as Ardha Chikitsa of the Shalyatantra means the definition of Shalyatantra. Shalyam nama Vida Tnakashta Pashana Pamsulu Holostrasti, Bal Naka Puyasrava, Dushta Vana Antargarbha. Bala Nakha Puyasrava, Dushta Vana Antargarbha. Means all these shalyas, all these foreign bodies, it might be nowadays we can consider them as a bacteria or any of the things. So, which way there is the formation of a wound. Dushta Vana Antargarbha, Shalyodharanartham. Shalya Uddharanam, Shalya means it might be the bacteria also, Uddharan of these things also.
Why is telling that?
Shalyodharanam, Yantra Shastra Ksharagni, we are using these things, Yantra Shastra Ksharagni Pradhanam, Vrana Nishchayartham cha. Nishchaya of the Vrana is there. So you can see, we can correlate this definition. Means lastly he is saying that, or firstly starting with all these things he said it, the concept of Vrana itself. And in the first Chikitsadhyaya of Sushruta Samhita, Chikitsadhyaya, Chikitsasthana, first Adhyaya also it is related with the Vrana itself. Means so Vrana is a main thing which he is focusing on. So in the Shalya Chikitsa, we are mainly focusing on any of the Vranas, right? So in every disease, we can find there is the minute or microscopic level of destruction of the tissues, which can be called as, or any of the breakage or in the continuity can be called as a Vrana. Or it might be through the molecular death of the tissues, which can be called as an ulcer, or through any of the external traumas. Means the concept of Vrana is there always. And he's saying that the Chikitsardam, Shalyatantra Chikitsardam, the Siravada Chikitsadam, Shalyatantra Prakritita. The Chikitsa Ardha is Shalyatantra. Means he said the definition while he is concentrating on the Vana, and while concentrating on the Vana only, he said that it is the half Chikitsa. Siravada is considered, or Raktamokshana is considered the half Chikitsa. Why to consider object? Again, there is a concept of run also. In your disease also, I can correlate this thing. How it is? Where there is a crack, means it is because of any of the excessive rukshata, there might be a crack, or there might be any of the molecular things which are causing to have a cracks. This excessive rukshata or excessive external traumas, there is a palm shoe and pashna. Palm shoe is also one of the shalya. Palm shoe means it is you can see the definition, right? So Shalyanavu with the Thinakasta Pashana Pamshu. Pashana and Pamshu Loha Lustrasti. So Pamshu means it is a small, it might be a small the dhuni kind of what we'll say. A dust particle what it will. So this will also be Shalya. How it is? It is the cause for having this one also. The cracks which is seen in the this legs also. Or in the Vipadik also, the cracks might also be seen in the things. So it might be seen, means the cracks in the hands can also be seen in the psoriatic lesions. So again, in the psoriatic lesions, where there is a wound, again in the skins where there is a cracks. So in all these conditions, we are using this Siravedana. And how it is the mode of action? Again, there is a repairing mechanism of the wound is there. The wound repair mechanism happens. What I said is repairing mechanism of the wound. So repairing mechanism of the wound, there will be inflammatory stage. After that, there is an inflammatory stage. There is a rate of this stage of this contraction of the wound. Then there is a stage of the reepithelialization of the wound. All these concepts can be correlated here. So whenever we are doing the Siravedana, we are increasing the RBCs, we are increasing this erythropoiesis. So whenever the erythropoiesis are increased, we are making out the healthy epithelial tissues to be increased more. So when the oxygen carrying capacity of any of the drugs is increased, means RBC is increased. So then what happens is this oxygen carrying capacity will improve the nutrition to the particular cells which are dead. So why it is improving the particular cells where there is a death or where there is need only there will be the oxygen. So we are giving the extra amount or extra amount of the nutrition to the particular wound to have the healing of the wound. So always, whenever we are doing in the cracks also, there is a wound. So that wound, we can see that wound can also be easily can be vanished off or it can be filled off by doing the Siravedana. So this is the same concept, means the concept of erythropoiesis can be applied, the concept of reticuloendothelial cells can be applied, the concept of this the hypoxia can be applied, which is again this hypoxia leading to the again these things. So while doing this, we are increasing the RBCs, we are increasing this oxygen level capacity of the RBCs. So oxygen level capacity means we are increasing the hemoglobin and all. So heme and globin, again there is a globin is related. So globin will be again the protein itself, which is building blocks of any of the cellulose. So building blocks of the body means it is called as a proteins. So amino acids will be improved. So when we are increasing the proteins by excessive amount of means we will be having the proteins, but the absorption of the proteins will be increased by you doing the Siravedana. So we can say that this Siravedana will be helpful in the cracks also. I hope I gave a satisfactory answer.
Please trap Jagdish.
Any doubts is there means you can discuss.
No
All
doubt.
the doubts. Thank you, sir. Thank you for this wonderful and informative session. Now, I would like to call our Associate Professor, Dr. Geetanjali ma'am, for vote of thanks.
ఇంకా మంచి హ్యాపీ ఉంది.
Om Shri Gurubhyo Namaha. Good afternoon to all. Hello, Dr. Rakesh. How are you?
Good afternoon. Fine.
Yes. Today we had a great session on critical analysis on Raktamokshana. Firstly, for this, I congratulate Dr. Rakesh for his wonderful, very informative session on this topic. And here, in this, the importance of Rakta, you should remember that thing. That is, Deyasya Rudram Mudam Rudreneva Dharate Tasmad Etnena Samraksham Raktam Jiva Iti Sthiti. Here, Rakta is the one which does dharana and poshana of the body regularly, and and we have to made an attempt to preserve that blood in a constant way, to preserve the blood and in a good condition, functionally as well as structurally. We have to maintain the blood. And here, when rakta vitiates from the other doshas, it can cause many of the diseases. For that, we advise Raktamokshana. Raktamokshana is the one we can detoxify the blood with the help of Raktamokshana. And Sushruta, already, as Dr. Rakesh sir has told, Sushruta has mentioned, it is Raktamokshana is one of the main important tool, and it is considered as Ardha Chikitsa in Shalya Chikitsa. And here, it gives me an immense pleasure to deliver vote of thanks at this session. And firstly, I would like to thank Dr. B.S. Saudi sir, Principal and HOD, Department of Shalyatantra, for his unconditional support and encouragement towards conducting these such programs. Thank you so much, sir. And I also thanks our director, sir, Dr. Praveen Kumar, sir, for his kindly support for conducting this program. And I also thank PG coordinator, Dr. Surya Narayan, sir, for his encouraging words towards our department to conduct this program. And also, uh, I thank today's guest speaker, Dr. Rakesh Kumar S. Gujar, for accepting our invitation for Shalya Prabodha online guest lecture series to 2023. Sir has enriched our students' knowledge for by serving his feast of knowledge for them. I am very much thankful to you, sir, and it was very informative and very initiative session. And for that, I'm very much thankful to you, sir. And also, I thank our Shalyatantra staff, Dr. Lohit sir, Dr. Jitendra sir, Dr. Anisha madam, for your support to conduct this program. And also, I thank our department PG scholars, and I thank all the participants who are participated in this session and made it a successful event. Thank you, one and all.
I don't know why she added me.
Welcome to studio.
And
Maybe.
after this, we'll wind up this session. And please, participants, please share your details regarding your email ID and phone number and your name to this number, which is shown in chat box.
And later it came to Sanjay Sari.
And also, any feedbacks are there, it is all open. Thank you.
Thank you, ma'am.
Thank you, sir.
Thank you for giving me an opportunity and share my views on the Raktamokshana. And I will be very much thankful to the principal, sir, Dr. B.S. Saudi, sir, and also you as my senior, Dr. Geetanjali, ma'am. I'll be always it's very blessed to have you, ma'am, with us as a senior. And I'm also very much thankful to all the organizers, all the lecturers of this Department of Shalyatantra. And also, I'll be very thankful to all the PG scholars of Shalyatantra of your college, ma'am. And thank you once again. And namaste. Thank you.
Namaste. Thank you, sir.
Thank you.
Now you will do, Allah.